Urine is produced in kidneys. It flows via the ureter into the urinary bladder, where it accumulates prior to being expelled through the urethra. A urethral stricture is a hindrance to discharge and may lead to urinary retention. The resultant pressure increase can cause the loss of parenchyma function, urosepsis, renal insufficiency, or fatal kidney damage. There are 4 therapy options. In case of urethrotomy, the constriction is cut. This results in a new scar. However, the success of this treatment method is often only temporary, the constriction becoming longer after every urethrotomy. An end-to-end anastomosis is possible only for strictures that are shorter than 2 centimeters. Side effects may lead to a curvature of the penis and impotence. There is also an option to widen the urethra using a tissue transplant that is taken from the oral mucosa, the cheek, and the lower lip. This method requires an additional operation in the mouth. These 2 operations in the mouth and urethra actually extend the duration of the surgery considerably and increase the cardiovascular load. There is a risk of injury to blood vessels, the salivary gland, or important nerves. This can cause multiple complications such as oral cancer, bleeding, continuous pain, continual salivation, a feeling of numbness, sensitivity disorders, changes in facial expression, scarring on the face, and permanent instability of dentures. The MukoCell method has been developed in response to this, as only a few cells need to be taken from the mouth here, irrespective of the length of the stricture. A tiny oral mucosa biopsy from the cheek of a patient is sent to the laboratory, where cells are isolated from the biopsy, cultured on a matrix, and build an oral mucosa transplant within 3 weeks. This operation using the MukoCell transplant is around 60 minutes shorter and more protecting to the cardiovascular system, nor is there any damage to the mouth. Since the transplant is built from the patient's own cells, compatibility is ensured. MukoCell is a gentle method of urethroplasty.